Years ago, the means available to medicine were so poor that the only real help that could be offered was loving care in the warmth of the home. In the 20th century, illnesses began to be attacked at their root. Scientific understanding and technology at last began to offer substantial relief. Inevitably, however, the model that prevailed was the hospital, which is of course much less homely than a real home. The successful combination of the latest medical technology with the traditional care of the patient at home is now a reality. The hospital-at-home model enables patients to receive the same integrated health at home as in hospital.
The patient stays home and his bedroom is transformed into an ordinary hospital ward. Doctors and nurses perform daily regular house calls exactly as they would do in the hospital. X-rays and blood tests are easily performed at home without any discrepancy. Any patient who does not require surgery or intensive care can be safely and efficiently hospitalized at home. When necessary, a bedside nurse monitors the patient closely and updates his electronic medical record. An open line with the hospital and physician's instructions adapted to online data resemble the conditions in a high-dependency care hospital unit. Doctors and nurses are on 24-hour duty for scheduled house calls or emergency ones on demand. For any examination which it is not feasible to perform at home, the patient is transferred to the hospital and then back to his home, just as he would be from and to the hospital ward. The medical team follow closely the patient's clinical course as they would do if the patient was actually in the hospital. The patient feels more comfortable and relaxed staying at home. The patient's mobilization, which is of great importance, particularly for the elderly, is much easier to manage at home, as whenever it is, he can get around his own familiar house. People receiving hospital-at-home services can continue to work at home, provided the nature of their work and their condition allow. This will be very difficult in a hospital.
High-technology portable medical appliances are becoming steadily smaller and ever more affordable. IT technology effectively shrinks distances, facilitating the monitoring of patients and collaboration between doctors over distance in real time. Modern methods in the management of medical information drastically reduce the probability of medical errors and ensure the provision of high-quality medical care. Such facilities, intelligently applied, enable safe and cost-effective home hospitalization of almost any patient whose condition does not demand prompt surgery or intensive care unit.